All right, great. So welcome everyone to our third episode of Coach Connect. Today I have special guest Dr. Angela Kugar. Really excited to have her on. She also holds a PhD in healthcare management and has held board certifications in 3 different allied health professions. She's a therapist, as an anesthesiologist, as a PA, and as a clinical research professional. 20 different large health organizations and community-based organizations, and led a health coach training pilot in Indiana County to train and place health coaches to assist the American Indian and Alaska Native populations with value-based care during the pandemic. She's also currently a part of the VA Whole Health Training Provider Education for health coaches that serve veterans. And she also created the first approved wellness coach apprenticeship through the U.S. Department of Labor. She's been paving the way for health coaching to be approved for the state level through workforce development programs and vocational rehabilitation programs for disabled and displaced individuals reentering their work remotely. Brenda Cougar, what a pleasure and honor to have you on our podcast today.
Thank you so much for having me, Diego. I truly appreciate it. I'm looking forward to sharing with your audience here.
Yeah, so today we're having a topic that I think I get asked about all the time, and there's a lot of confusion from both students and coaches as well. And so really glad to have you talk about insurance coverage and different ways that we can have lower the access or the one of the barriers, right, for our clients. So maybe you can start off by explaining what kind of coaches are eligible to have some of these benefits for different kind of coverage options.
Yeah, I'm glad to be able to help and cover this because I think there's a lot of confusion about health coaching and billing. I know that there's still health coaches out there who are new graduates or people who are thinking about health coaching and they're not sure about insurance billing. And so some of them even think that insurance billing is a myth. But one of the things that kind of
Mhm.
breaks that down is the fact that insurance companies offer health coaching. So being able to offer it as a service is not a myth. So they've got to kind of start thinking through, well, who told me that and why do I still believe that, even though now it's also covered through Medicare, Medicaid. And so um, to answer your question about who can bill, one of the things that we have to be aware of is the standardization of billing and why it's important that individuals know that they can bill because they're a board certified health coach. Now, I will also say that probably in about 2022 was when the American Medical Association kind of shifted the rule around that and stated that anyone who had completed an NBHWC approved program was eligible to bill. Now, I always tell people this was probably at the height of the pandemic. This was when we were trying to reestablish what is a normal volume in hospitals across the US. And so preventative care was at an all time high. And so they're looking for individuals like health coaches to be a part of the telemedical community. And so that is why they kind of loosely said, hey, if you're a graduate, it's all hands on deck. We need you to help. So, and that's actually still printed in the American Medical Association, the guide for the CPT codes in 2022. Now, a new guide is probably going to come out in 2024. And it usually has any dates that have happened over the last couple of years. And so I always tell people, you never know when they're going to change that. Just get board certified. That
Yeah.
was kind
Okay.
of
So
to kind of plug up a hole that we had. And so always, all roads should always lead to getting board certified.
yeah, it's great to know. So maybe people who are currently just graduated and waiting to take the exams can may take advantage, but knowing it's a limited window. And I do want to kind of echo that message, right? To me, the more nationally board certified coaches we have, there's a lot of benefits, right? The more awareness clients will have what this actually means, but also the bigger the community, the more leverage we can have on these policies, on impact, on coverage, right? So the bigger this pool is, the more powerful we can be as a community together. So I agree, all roads lead to that standardization and professional care.
Absolutely.
Yeah.
Absolutely.
Yeah. And so there's a few different routes that coaches who are board certified can use to help with the payment, both as for insurance coverage and health savings account. Can you explain maybe what those different options are? Maybe we can dive into each one of them separately.
Yeah. And so there's two different kinds. There's FSA and there's FSA. So some people, if you're not familiar with this kind of coverage, you may not know that it exists. So an HSA essentially is a health savings account, and that's what HSA stands for. It's a tax advantage type of savings account that is a part of your benefits package through your employer. Now, the health savings account, the individual has full control over. So they can add money to this account tax free. They can add, the employer can also contribute to this account as well. But the employee, the person who owns the account, is is able to use the account no matter where they go. And so they have this flexibility associated costs that may not be covered under their plan, or it's for individuals that have this attached to what would essentially be a high deductible healthcare plan. So it's going to cost me a lot of money just to kind of get in the door and get a healthcare service, and I've got to pay that deductible before I start anything else. Well, a way around that is to pay for procedures with the money you've accrued in a health savings account. The other beautiful thing about an HSA account, besides the fact that you can now use it on Instacart, you can buy, groceries and different things on Instacart. There's a lot of things approved now for HSA. The flexibility of that account is up to the employee. So they can take that money wherever they go and it rolls over. So even if they quit, they're vested in that money through that employer and they can take that account anywhere they go. The use of that account is usually like a debit card. So a Visa, MasterCard, something like that, that's attached to their healthcare benefits. Now, the other part to this is the flexible spending account. Flexible spending account, or FSAs, are a little bit more rigid. They still have the same implications, high deductible plans. So you've got this kind of as your scapegoat, basically. So you can pay for things with that card, smaller procedures or other approved expenses with that card. A lot of people use this to buy pharmaceuticals, things that they can't afford or don't have a plan to cover out of pocket. But the only thing about an FSA is you don't have, even though it's flexible, it's weird. You don't have that over. It's usually a use or lose. So you see a lot of people kind of dumping their FSA plan towards the end of the year when they've accrued a lot of those funds over several pay periods as an employee, and now they're looking for something. So they may have thousands of dollars in there that they can use for health coaching services, they can use in for group coaching. So now health coaching is approved for that. And so it really lowers the barrier of entry for someone to work with a graduate. So I always tell our graduates, if you're board certified, ask the people that want to work with you, do you have an HSA? Do you have an FSA? And it makes it a really simple process with them being able to just sign up for those services. So that's essentially what those two are. And your FSA, you cannot take that plan with you. And because I've had both, I've had several of both in the past, like when I worked in the field, in different fields. But I do remember, um, having that HSA throughout my 20 plus years in healthcare, and being so grateful that I was contributing to that plan tax free, that I was just accruing that money and then I could use it for so many different things. And it was just amazing to be able to have that plan. And then of course your FSA, use it or lose it. It doesn't roll over. The employer keeps complete control. You cannot take it with you.
Okay, yeah. So the nomenclature is almost a little counterintuitive. So flexible and actually is a little more rigid. So to kind of summarize,
Yes.
if I understand correctly, flexible accounts stay with you in employment. If you leave that employment, you no longer have it. There's also a time limit. It's by the December 31st. Is that right? It's a calendar year that it runs out. So in that case, if you have a client who has FSA account, maybe they have that money, it's use it or lose it. Well, you might as well use it in health coaching. You might as well use it for something. So actually could be an incentive for them to get some benefit off of this tax-free. The HSA account now has actually more benefits where it goes with the employee. And if you change jobs, that money's there and it can continue accumulating. So both are able to use by board certified coaches.
Mm-hmm. That's right. And so the other part to that I think people miss is that letter of eligibility. So there is so for different kinds of services, if there are smaller expenses, like you don't need a letter of eligibility to use your HSA or FSA card to pay for your prescriptions, right? You don't necessarily need that, right? But for certain kinds of services that might change your body long term or change your long term, like or in the instance of health coaching, you do need to have a letter of eligibility from your physician to say that your need for health coaching is in alignment with your care plan, right? And it also can state the types of things that can be covered or here are the reasons why. Now, the beautiful thing about this is for board certified health coaches, NBHWC has already created that letter of eligibility that those graduates can use and give to their clients to simply have filled out and signed before they move forward with their services. But it's a very seamless, simple process. And most doctors are in alignment with that because usually the health coach is covering something that their practice does not typically cover. And it's an ally to what they're doing and in alignment with what the outcome the patient is looking for too.
Yeah. So the letter of medical necessity, like everyone said, like you said, it's on the board website in the forums there, and it's something that you can. It's pretty standard. Ask what the patient is, right? So what diagnosis could be helped. I remember asked someone, well, what could be helped by that? And it's like really anything, right?
Yeah.
Because anything can be helped by behavior change. Taking a medication is a behavior, right? So it's not just for traditional things like blood pressure, cholesterol, but even mental health, right? If we're working with depression, we know movement and activity is really good for depression, right? Or anxiety, social connections, right? So the idea is that don't think that like which is covered, any diagnosis, any medical issue can be helped by behavior change, right? So we actually, there's a reason why there's not a limited list because really anything can. And if it's helpful, I know from medical background, sometimes they're busy people. You can help fill it out for them, right? The doctors will sign off of it, say the diagnosis, but really talk to a health professional and let them know that this is going to help them with that value-based care, actually help the care. I tell people, if medicine is what to do, health coaching is how and the why. Right? You to lose 30 pounds, how are you going to do that? You got to lower your cholesterol, how are you going to do that? Right? So this is the allied professional, people who are experts of behavior change, to walk through what that looks like for that individual to take that
That's
care.
right.
Anything else, Dr. Angela, about the letter of necessity or people should know about that we haven't covered yet?
No, just that you need it if it's specifically for HSA and FSA. And from what I understand, it's typically used for NBC HWCs, but I have seen non-board certified people use it successfully, especially when they have larger groups that they're coaching. I've seen, and the majority of those individuals only have an HSA or FSA to pay for the services. So I have seen several people use it successfully even without that, or while they're waiting to take their board exam.
Right. So kind of idea here is like try and ask, right? Let's see what happens. Like it doesn't hurt to
Yeah.
give it a shot and see if you get some coverage, right? Even while you're training, and then you might and also I said too, you might learn what works or doesn't work, right? Maybe they say no, you need to have X, Y, and Z. Now you learn it doesn't work, and can for next time when you submit that be more successful, right? So it's a lot of it's fairly new, a little bit of trial and error here, and so share with other coaches what's worked for you and how you can be most successful in helping our clients lower that barrier for cost.
Yep. Mm-hmm.
And so, Dr. Angela, another question to get asked a lot about is, so health savings account requires someone to already invested in their account, right? And if you're working with a client who hasn't already, you can encourage them to start investing in that as they work for you, right? So it's never too late.
Yeah.
But the other question I get asked about is insurance coverage and CPT codes and what that is. So do you mind explaining maybe even what a CPT code is, where we are with that? It's a
Yeah.
longer conversation, so we'll have multiple questions. So if you can just kind of inform people who aren't aware of that, what it means and where we're at.
Absolutely. So I think the first thing to remember is that CPT codes are controlled or created. I always say they are created or destroyed by the American Medical Association. And so they are the governing body over what codes get added, removed, combined, covered, or no longer covered. So they are the number one source for that. From that place, whatever codes are created and whatever coverage is happening, then it trickles down to commercial insurance companies and federal entities like CMS, the Center for Medicare and Medicaid Services, right? So they are getting there. So people might say, well, why doesn't Medicaid cover this? Well, AMA didn't create it, or AMA doesn't no longer says that it's a rule anymore. So don't be frustrated with the entity. It's more about they're only following what they're how they're being governed, right? So their hands are tied. They're only
Mm,
distributing and making sure the codes are properly being used. The standardization of which codes happen comes from the American Medical Association. And so essentially, CPT codes are the procedural, they're called current procedural terminology codes. And essentially, these help us standardize what procedures are actually done to a person. So I always tell people back in the day, I mean, way on back in the day, like early 1900s, 1800s, when we did have physicians that were working on people, there was no way to keep up with, okay, Dr. John Doe pulled, right upper molar tooth number such and such from patient A. There was no way to keep up with what was happening
mm,
to people procedurally. And so once we started to advance in the field of medicine, the American Medical Association started to say, hey, we've got to keep up. How do we know if Jane Doe's left kidney is gone? Right? We don't know that. We've got to have a way to have tracked this procedure and who actually did it and all of the nuances of that procedure. What was actually done? What happened in the room for this procedure to be a success for Jane Doe, right? And so we have
mm,
to have a way to standardize what happens to a person's body, what procedures are actually done to a human being. That is where these codes come into place.
mm,
And so when we can wrap our mind around why we have this system, then we can also start to understand how coming from early 1800s, 1900s, all the way till now, where you've got procedures that are combined, you've got codes that are no longer relevant anymore because technology is taking over. So we have to remember that the codes today might not be the codes tomorrow. And so to be frustrated about codes and how we build, that's irrelevant. It's just a matter of understanding what codes relate to what I'm doing to a person. What codes relate to
mm,
the procedures that I know I can do with my license to a human being? How am I tracking that through my care plans? How is that trickling down, and everything that I'm doing is streamlined and it makes sense and it matches these codes? That is essentially why we have CPT codes, right? It's also, and I'll say this, it's also why when we try to ask for information outside of AMA, so a lot of people will like say, well, I've reached out to Center for Medicare and Medicaid, they can't help me. Or I've reached out to the insurance provider and they can't help me because they don't govern the codes. AMA governs the codes, they're just carrying it out. And so it's a matter
mm,
of understanding Well, if I need something covered that's not covered, how do I get creative and make sure that it is covered? So we have to understand how this actually works. The other thing to understand is that CPT codes are relatively based on tasks. It's who did what and when. That's essentially how these codes
Mm.
work. And so when we think about that, there are tasks that, a gastroenterologist might perform as a standard of care that a cardiologist might also perform. They can both use certain codes. So we have to keep that in mind as well, that codes don't necessarily belong to one practice or one license. So someone might say, well, we can't use behavioral change because then the counselors will get mad. Yeah, but you're doing BHI, you're doing behavioral health intervention in two very different ways. So one can't do what the other is doing. It comes down to your care plan, and it comes down to what you know you did with that client that you can track and build for. And I think that's the key that I think people just miss. And I think always have a healthcare background. So this is just new terrain altogether for them, and it can be very convoluted, but we don't have to get lost in the weeds. We just have to understand, what am I doing? What do I consistently do with all of my clients over 6 months that I can build successfully for? And what are the codes that govern that? Now let me try to get my money. Like that's what we have to focus on.
Yeah. Well, it's very nuanced. And you're right. It can be very overwhelming, but I think a lot of key points there. That it's not that one code belongs to one organization. It's only health coaches use this code. It's like, what codes relate to what I'm doing, right? So I think we mentioned the creativity part. I know the board lists like 4 different codes for coaching. We can talk about those. But you're saying, let's get creative. What else are we doing? And really, does that align with that care plan for that individual? Then we can have more opportunity to write. Because something said, we get paid, because someone told me this. They go, Diego, if you keep on giving it for free, this can only be your hobby. You can only do your hobbies on Sunday afternoons. You won't help that many people
That's
out.
right.
And so, a lot this morning for money. It feels uncomfortable. In medicine, I didn't have to, help the patient out. That was in the background. But think about this: if you want to give your gift of coaching, right? You have to be able to figure out how to make this sustainable for yourself as well. If you can only make this a side, hobby, you're going to limit how people you can actually serve. So it's not a selfish thing to make a living off of serving others. That's something I think coaches sometimes
Absolutely.
can struggle with.
Absolutely.
Yeah.
And really, it's about, it kind of brings home how health coaches have to hone their expertise. Because if I have a 6-month program as a board certified health coach that helps, single mothers over 30 with fatigue and burnout, and we're looking primarily at nutrition therapy and behavior change, I'm looking at codes in that category. What I'm doing with my clients over 6 months is consistent. My care plans can be customized, but essentially the time I spend with Mrs. Jones versus the time I spend with Mrs. Brown, it really doesn't change. Like what I'm doing, their goals are very much the same. Their goals can be the same very easily.
Mm.
So I say that to say my care plan and how I standardize what I'm going to do with those clients concerning burnout, behavioral change, and nutrition intervention, those things don't change for me as a health coach. Those are the things that I know that I've honed my expertise in, and I'm covered with that. So I can use the code because that's what I'm actually doing. And so, or I can make the attempt to use the codes, because I think the other side to this is, just because you bill doesn't mean it'll get reimbursed. And so what people might
Mm.
walk away thinking is that, well, I didn't get reimbursed because I'm a health coach and I can't use the code. No, the other person down the street that's not a health coach, that's in another field of expertise, they got rejected too. You probably got rejected because the code doesn't exist anymore. So we've got, so it is that convoluted thing to say, okay, that one didn't work. Now let's find the one that does. And so this is where my course comes in. This is where how you find the new codes quickly and turn around that billing quickly. That's where we needed a course for that so badly, because people were really getting discouraged. Like, no, they don't cover us. No, you just haven't found the one. And probably by the time you do, they're gonna change it again. So use it, use it, use it.
It's a little bit of whack-a-mole, but you got to keep that hand active, right? Yeah, that's a great point. A lot of people think, well, it's something I did wrong, and we tell our clients to constantly retry, right? And I think the same can apply to us, right? I think being successful doesn't mean consistent, doesn't mean doing the same thing over again, but consistently retrying, right? Talking to people. And I think the course you created, and I want to talk more about that, because a lot of people hear me having, well, what are those? How do I find this? It sounds good in theory, but I'm still confused. I'm not even, I'll be frankly, even being a doctor, codes are confusing, right? Even having to do it there. I think there's, to be frank with you, purposely confusing for some people, right? And then so for some organizations. So love to tell me about your course, Dr. Angela, and kind of what's covered there, what it's called. And then we'll put a link in the bottom too as well, because I do think it's a great service that all coaches should educate themselves to understand, right? And I love that it is changing. You have to stay up to date with it. So please tell us a little more, like kind of what's covered in the course and what inspired you to do this.
Absolutely. And so one of the things I would say that inspired me to do this is because I did work with the Native American and American Indian and Alaskan Native AIAN populations with the federal government. And so they wanted to bring their numbers of casualties for COVID-19 down during the pandemic. And so they wanted to institute health coaching throughout Indian country in the form of a pilot. And so there were over 1,000 practitioners that stepped up and said, we will do it. We will go through the program. We will get board certified, and we will immediately start our services. And so one of the barriers that they had was, well, how do we bill for this? We've got more than enough people who qualify, but how do we bill? And so, of course, then it became my barrier. Well, how do we bill? I know we've got the CPT3 codes, but I think it's important to understand levels, the coding levels, because we have CPT1 codes, which are widespread everyday use codes that are ready to go, is what I call these. And then you have your CPT3 codes, which are experimental codes. And I want to speak specifically to CPT3 codes that are specific to health coaching. So experimental codes that are specific to health coaching. Typically, it can take up to 10 years, a decade, for a code to go from category 3 and put to category 1. Well, within a matter of probably 2 to 3 years, the CPT3 codes for health coaching, they qualify to now go. I think the pandemic is what escalated it to be qualified to now apply for it to be a CPT1 code. And organizations like NBHWC have the task of making sure that these codes become level 1 codes. Well, in beautiful AMA fashion, when it comes down to it, through AMA and also through information from CMS, one of the things that the information that I got that we found was that they said, well, what you do is not as unique as we thought. In so many words, what you do crosses over with so many other codes that we already have. It doesn't make sense to make a code specific to you, because again, AMA's job is to streamline tasks, is to streamline what is already being done. So if you're pulling a tooth and they're pulling a tooth, I don't care what your license is, the code is available for both of you. So so we have to remember, if we're waiting on CPT1 codes, it's just not going to happen. What you do, people have been billing for the types of tasks are capable of doing under their legal scope of practice for decades, right? So these are codes that are available to you if you know how to use them. Now, the powers that be, AMA and like AMA, CMS, insurance companies, they cannot ever legally tell you how to use a code. And so it is up to you to do your own research, know your care plans, know what tasks you actually do with the patient, and be able to articulate that in your billing. And this is where the standardization of health
Mm,
coaching and all those things start to come into play. So all of these things inspired me to create this course. There's so much frustration among the board certified community, and rightly so, because we want to help. And I think that's where the frustration comes from, just that deep desire to help. And there's a book I read called The Science of Getting Rich. And one of the things that he talks about in there, he says, when man has, or woman has a desire, it is basically function seeking performance. It means that something in me wants to perform this task. And when I cannot do that, I am going to be frustrated because I don't feel like I can grow any bigger than where I am. So we have to understand where the frustration comes from. And then the only thing I decided to do was try to find some kind of small solution that will at least say, let's bring everybody into a level playing field. So we at least understand CPT codes. We understand what billing is. We understand that we can bill. It's not a myth. And we understand why we're getting rejected if we are getting rejected. And then from
mm,
there, we build care plans. From there, we standardize how we help people. Your function can be performed much more efficiently when you understand what you really do have to work with. And so that's why I created this course. And I've gotten so many great reviews. I've gotten CEOs of very large corporations saying even we were lost on how to do this because, again, we want to offer health coaching, but we're stuck. We can't service these people that have only insurance, they're not cash pay. And so we've got to figure out, now that we know that there's a pathway forward, we have internal billing. We know that we can now do it, and it'll be trial and error for us, but we can at least get it done. Uh-oh, I think you're frozen. Can you hear me? Can you hear me okay?
Sorry, I lost for a second there. Yes, I'm back now. I heard that's why we have, and then can you repeat that? I think off the last maybe 30 seconds, something happened there. Can you repeat that last little part? Maybe the audience heard it, but I missed it, to be honest with you.
Absolutely. I think I said, I said that's why we have this course, is to help kind of level the playing field so everyone understands what they have that they can actually work with, and they at least have a foundational knowledge on how insurance billing works, and then they can understand how to
Mm,
make it work for them.
yeah. It gives, I think, me so much hope. I'm sure people listening too, because there's so much confusion, and I think people are right. Focus on CPT3 codes. When will we get class one? When will we get class one? And your knowledge is great. If multiple people use the same service, they can build for that. It's not only specific to coaching, right?
Mm.
So just because that's not there, let's find that solution. And I'm also, let me know what you think of this. Kind of saying that your documentation kind of here will matter as well, right? So you have to just see the client say, I saw him on Tuesday, but what was your plan, right? Have a place,
Mhm.
hopefully like Bible, you can write your documentation, keep track of it,
Right.
right, in a HIPAA compliant way, so that when you submit these codes that you're creatively finding, you're treating it like professional. The way doctors have notes to write to turn us in. You can't say, oh, I saw him on Tuesday. What were you doing? Prove to us that there was, what happened in a half an hour that you were talking about. What happened in an hour? What are the plans forward, that why we should reimburse you? And that really, Dr. Angela, thank you for creating that, because it's the most
Mhm.
common question I think I get asked. And it is a little bit of whack-a-mole. So understanding the system, and here it does require also being persistent. This is an evolving body, right? Codes may come and go. So don't take the no as it's not happening, just not yet, or you haven't found your way of doing it, but really find
That's
support,
right.
find someone who can help you out, like you. If you need more guidance and mentorship, you're not alone in this. And there are a few questions here I'm looking at the comments that I want to address. One is from
Okay.
Wendy Williams. Hi, Wendy. She asks, she's not finding the letter of necessity on the MHC website. It's once you log in, it's in under the resources. You have to log. I think you have to log in as a provider. I'll be happy to put that link there. And actually, Bobby, we're going to have that in your resource folder as well. And then Leslie Miller, hey Leslie, ask, so you don't need the physician to approve the MBHC letter of approval. So I think actually, I'll let you answer that question, Angela. I think I know the answer, but please,
Yeah.
if you can answer that question
Yeah.
from
So
Leslie.
so I will say that I have seen people successfully use their HSA and FSA cards with their coaches without that letter. And it's because that coach is probably some group coaching and those people want to join. And so I have no way of knowing if they went back later on and got that letter, but the card is open and available for them to charge it. So
Mm.
you take from that what you will, Miss Leslie. You let me know how, you take from that what you will. But I've
Yeah.
seen clients not wait because they don't want to lose their seat in a program and they really need the help. And then maybe they go
Right.
back later and get it. I mean, that's the only thing that I can think of. But the card doesn't stop working because we're waiting on a letter. No, they just charge it and use it for
Mm.
what they want if they have it available, and they go back and get the letter later. So don't let that stop you, right? So work it that way. And then if you have to go back and forth
Yeah.
with the
Yeah.
physician, you don't want to hold up a client trying to figure that part out, because it's in alignment with what they want. And the number one indication to do something is because the client or the patient said yes. So you want to make sure that you are giving them the service that they asked for. And so I hope that makes sense. Yeah. And then
Yeah.
Wendy, to speak to Wendy's question really quickly. Yeah, the letter, I guess, I don't know if it's on the website. We issue the letter as the founder. Our administrators issue the letter when the students ask for it. So it's not, I personally don't have that as a founder of a school. I don't have that letter open and available. They have to come to us and ask for it or request it through email. Now, it might be out there on the MBCHWC's website. I wouldn't know. I wouldn't know that.
Yeah. It's somewhere in I have to look exactly where it's in the login, but basically the letter is not unique. It's a template. It just tells you what you would do. It basically says, this person's under my care for these diagnoses, and that would be helped by health coaching. I approve, like signed by physician. That's kind of the gist of it, right? So you can even create your own. It's like a template idea. And Dr. Angela, so also a few minutes here, actually. So I was asking about MPI numbers. I'm sure maybe the course kind of covers that as well, because in order to do some of these, you might have to be MPI registered. Do you have a minute or so to talk about that, or how it's covered in the course? Because some people might not know or have some questions around that.
Absolutely. I can't remember if it's covered in the course. I'm sure it is. But MPI numbers, the best way to think about these is, remember when we talked about how you track what is being done to a patient or a person's body? We track that through the task of a CPT code or an assigned code. And again, you, me, and someone else may be doing similar tasks that are the same in that code. Well, MPI numbers are a little bit different. They standardize who actually did it. And so an MPI number is basically an identifier for a provider that is usually issued once it is applied for, after they have a credential or a certification or a license for something. Now, MPI numbers are only issued once and they can never be duplicated. And the only time they no longer exist is when that provider is no longer alive. So it's like your social security number. No one reuses that number.
Mm-hmm.
That number is no longer available. It stays with that person from the time that they are born, or the person or parent applies for it, and it's no longer usable when that person is no longer alive. NPI numbers are the same way. So if you've been a healthcare provider and you've worked for a healthcare organization that accepts insurance, more than likely you have an NPI number, and you can do a search for this because your NPI number is basically how they paid your salary. They billed for your
Yeah.
services and they paid you. Unfortunately, they paid you part of what they got back, right? Let's just be honest, right? Right, because there is a cost to do business, right? So they paid you a portion of what
Uh,
they got back. But if you've ever
right.
provided a service or a task that had something to do with someone's body in alignment with the CPT code, your number was attached to that code. So you can, if you do an NPI number search, which I encourage everyone to do, because you never know, you may already have a number. If you've never been in a healthcare organization, and or you haven't done anything in healthcare, and that also includes mental health and things like that, then you probably don't have a number, and then you can apply for one. The other thing that I will say is to, and we go further in depth with this in the course, is you need to understand how your health coaching practice is set up. Are you set up as an individual who can work for an organization, or are you the organization with yourself and you can add other coaches on? So, like in the case of Vibely, as a great example, Vibely would get credentialed and get its own NPI number. And then it can add every coach under it so that it can help streamline the billing, the task, the standardization of what we're doing, or with and for our clients. I hope that makes sense. So let me know if you guys have any questions about that. So your NPI number, you either apply for it, or like a parent with a social security number, an organization that hired you, they may apply for it because they have you under their organization. However, you can still apply for your own organizational add yourself under it. So you can still be under several organizations, almost like a contractor that works for several doctors'
Mm,
offices. You could still be under several organizations and bill. It's just a matter of who is the provider who did the task. So I need an NPI number for every CPT code. I need to match that provider with this code or with this task. And then the other thing to remember is when you're applying for your NPI number, it will ask you what is your credential? What do you do? Are you a doctor? Are you a dentist? Are you a counselor? Are you a health coach? What do you do? So it's going to match that. And so there is some streamlining. So for example, if I'm a dentist and I'm holding behavioral health counseling sessions, those don't typically match. That might flag
mm,
something in the system when it's billed. And so it is still there to streamline, but even if your billing gets rejected, it doesn't mean that you can't use the code. It may mean the code is obsolete, or you're using the wrong code. There might be another one for that particular task that it's now combined, right? And so
mm,
AMA tries to wait until their edit every year or every 2 years to change up the codes, but that doesn't always happen at the state level, right? That doesn't always
mm,
happen. And so you might go to bill for something that you billed for last week, and the state has already changed it, or someone else, AMA, has already shifted those codes and combined them. So it
mm,
could be an infinite number of reasons as to why your claim might get kicked back. But it's about understanding and having a billing expert that can help you. And that's where the cost to do this comes in. That is more of a heavy lift for health coaches. And so Diego, they find it easier to come under like a Vibely, or they find it easier to come under a
yeah.
doctor because his or her business is established, and they can absorb the cost to do business in terms of billing and the time, the administration time to go back and forth until my claim gets approved, right? To try this code, now try that
Yeah.
code, now try that code. These are constant
Yeah.
submissions, and insurance billing companies are super savvy at this, but they are very expensive. And the course teaches you all of this. Well, where do I
Yeah.
start? I'm starting. Where do I begin? Where do I fit in if I'm new? How do I know I should set it up as a group MPI or one on my own? So it gives you a lot of insight and examples on how you actually do this. And then I do some walkthroughs, some screen shares and walkthroughs. If you get rejected, what do I do now? What can I immediately do to see what to do next? So it's pretty comprehensive.
Yeah. So much great information. And I want to kind of rate this fact that even physicians, their codes get rejected. Like, right? It's real. Insurance companies don't want to pay money. It's a loss on their ledger. They're a .com, not .org. Their whole thing, they have people to just reject, and I have many thoughts about that. I'll leave for later on, more colorful words, but they don't want to pay out money. So they'll go through song and dance. Many physicians are back paid 6 months to a year for things they've done that are definitely been covered, but they just the song and dance, right? So they want to frustrate both coaches or providers and clients to not have to pay and be very real about it. They just want to frustrate you, and then either you don't get the service or you pay out of pocket. So I want to say this is not just specific to coaching. This is for all healthcare providers. That's their goal, is to not pay you, right? So we have to be savvy and advocate for ourselves and advocate for our clients and say, it's not just you coaches that we're diminishing. No, this is doing for everyone, right? And so continue trying. That's part of normal healthcare, or it's normalized in healthcare. It shouldn't be normal, but it
That's
has
right.
unfortunately been normalized. Let's put it that way. Dr.
Mhm.
Angela,
And
thank you
so
so
I tell
much. I
people,
wish we, oh, please.
no, I was gonna say I try to tell people healthcare is just the sandbox we're playing in as health coaches, and so you have to
Yes.
you have to play by their rules. And I love what you said about insurance. Insurance in general, you pay in every month, but when it's time to pay out, they don't want to do it. Like it's just what we
It's a
got.
loss on
Like
the
it's just
ledger.
part of the course.
Yeah. Exactly. So kind of learning. So, but this also points to the power of education and knowledge you're giving to this course, right? The more you know, we didn't choose a system. The more we know, we can both play within it, but also the more coaches we have, hopefully bigger influence we can have on that system as well. So as an individual, you're doing your part, but as a community, the bigger we are, the more board certified coaches they are, the bigger we can help have influence to what the system and game is like. So it's a two-sided approach. And thank you for helping bridge that important gap that we have. And for all the coaches here, few things I want as we close off. Where can they find this course? Because Viably is definitely going to promote it, and every Viably coach will have a link to this as well. But where can people outside of Viably find this course?
Yeah, you can find the course at the link, and I'll share that link. I wonder if I can share that link in the chat. Do you think I can?
Yeah, I was trying to do that earlier. I think that's why my computer got a little slow. That's why my delay. I was trying to have it ready, and I think that's what slowed me down. I can share it in the chat. And while you share in the chat, Dr. Angela, I want coaches who are on Viably know in the background, this is on my mind 24/7. How can I make this easier for coaches? Not only your scheduling, your admin, but if I can make it easier for coaches to get paid and reimbursed through this, that's kind of the goal. So know we're working on this, and know that's our goal, to make it so that if you're a solo coach, you don't have to hire 40 billers and be confused, that we can have a company that can support that solo coach to have more services so they can make it a living and serve more people. To me, the more people you serve, the better world we're going to have. So this is something very near and dear to my heart. Personal chip on my shoulder about insurance companies there, and I want to figure out how to change the system. So this is a collaborative effort. The more we can talk to each other, what's working, what's not working, the more we can share information and help the whole community out. So just know that Viably is in the background, diligently trying to work and figure out some of these things at scale for these solo coaches. Let's see.
Okay.
Private
So I shared it. I
chat.
shared it
Okay,
in
great. I'm gonna put
the
this
private
chat,
chat.
the
Yep.
link here. Mhm.
Yep. So
Yep.
they can grab it there. And that
And
course
there we
is
go.
approved
Oh,
for It's approved for use for those of
Oops.
you who are board certified.
And actually another point about that. Sorry, I put the wrong link there. Yeah, okay. There we go. Is that these for board certified coaches, this will actually give C credits for this. So not only are you going to get paid, help your clients lower that barrier, but you're actually contributing to your continuing education, right? So this is a win-win-win. Your clients win, you win, and your recertification is helped out by this as well. So to me, it's really a no-brainer.
Yep, yep, yep. And if you have any questions about
Great.
the course, you can find me on LinkedIn. And a lot of people send me inboxes. Okay, this is what I'm doing. I just need a little bit of help. It's okay. You can ask because I know it's new for all of us, really. So
Yeah. Well, Angela, thank you so much for your time today. But I really do mean thank you. Okay. We'll send the link somewhere else. Right now, it's not showing up, but I'll make sure we'll
on
post it on
LinkedIn,
LinkedIn and
yeah,
our socials as well. So we'll make sure after the
yeah.
stream, we'll post it all. Thank you, Wendy, for that comment. I'll make sure we get out to everyone, both in the community vitally, but also in general. I want to say not only thank you for your time today, but really thank you for all the work you've done through your career to help others, right? All the things you've done for different communities, and now to really, I think we both are passionate about changing the system, helping those who serve others, right? And I know this is one of the most commonly asked questions, and I really do mean it. Thank you so much for helping everyone do their best work.
Thank you so much for having me. It's always a pleasure.
Yeah, all right. Well, take care, everyone. And we'll put those links up after I hang up from this call right now. So have a wonderful rest of the day. And we'll see everyone in 2 weeks for our next live podcast. Thank you, Dr. Angela.